Breech. Do you think you're a chiropractic care candidate, or maybe you should go straight for the C-section? In this One Belly Wednesday, what we're going to do is talk about who might want to get checked out first by the chiropractor before going ahead and scheduling something like that. My name is Dr. John Edwards, and one of the things that I do as a chiropractor, specialize in working with pregnant patients, is ask some questions of myself whenever I'm looking at expecting mom's body. And listening to her history and kind of what she wants out of her birth. If a mom is coming into my office, the chances are that she's already made the decision that, hey, I want to give a conservative care a chance. But so many times moms don't even know this is an option. And so one of the things that I want to explain today is a little bit about who should probably investigate chiropractic care as a conservative option first before deciding to go ahead and do a belly birth. And there's nothing necessarily like wrong with a belly birth, right? I mean, you're talking to a guy who was a belly birth because he was breech. So I want to make sure that everybody understands that this is coming not from a judging place, but necessarily from a potential place of being able to get a baby more room in the pelvis so that if it's possible to get head down, he or she can do that. My job as also an instructor for other chiropractors is to help them understand that there are several things that we need to be checking for. And this is generally as a patient, what we're going to be looking for with you. So the first thing that we want to find out is, has there been any history, like in the past for you, of trauma where you fell on your tailbone, or maybe you had a slip or fall or something like that may have strained something in your pelvis and put that out of alignment? If you had something like that, the chances are really good that part of the problem here is that your sacrum or your tailbone in the center is out of alignment and simply just needs to go back into the right position. It's also very possible that if you've been a very active person most of your life, that you've developed a really super strong pelvic floor. So good for you, right? Unfortunately, that becomes a bit of a trampoline, and babies have a really tough time getting their head nestled down all nice and snuggly wuggly inside a cervix. If that trampoline is the pelvic floor, their head just kind of keeps on bouncing out of it. So you know it's nice and soft and squishy, your diaphragm. And so they'll go ahead and push their head right up that way because they have a little more room for that. So if part of the issue here is that you've got a super tight pelvic floor because you used to be an athlete, that completely might be part of it. Also, some of those moms will tell me that they've had some back pain, like some spasms. I just had a mom come in yesterday that told me that there was a physiotherapist who used to push on this point just off to the center of her back and would completely relieve her pressure. And where she was pointing to was a muscle we call the psoas muscle. Psoas is the longest muscle in your body. It runs from your back, kind of just underneath where your ribs go, runs past through your abdomen all the way down here into your pelvis. And then there are some fascial extensions that go all the way down into the inside of your thigh and your knee. And so that psoas muscle is really easy to tell if it's tight or not. Basically, what we do is I just kind of look at a mom while she's laying on her back, and I look to see if her toes have a tendency to go out more on one side than the other. If I look at her when she's standing and her toes tend to go out more on one side than the other, there's a really good chance that that psoas muscle is already tight. And the other double check I'll do is I'll just simply hold on to their arms and I pull them up while they're laying down overhead, and I look to see if their fingertips are even. If they're even, then we've got good balance there in the fascia coming down the sides of the body. But if one's shorter than the other, that usually means that we've got restriction. Here's why that's important. If there's restriction coming down that side past the uterus, then what ends up happening is it creates a wall, and babies have a really tough time getting head down if now we've got this spine wall for the container, this side wall of the psoas, the top part here, the diaphragm's tight, and the bottom part here, the pelvic floor is tight. There's not a whole lot of room or possibility for that baby to be able to get head down. So we need to address those things and balance that out. And the last thing that we want to know is if part of the reason the pelvic floor has such high tone is because it's trying to hold the pelvis together. So some moms come in here with a baby who's in a breech position, and we're looking at them and we're saying, okay, so tell me about how your pregnancy's gone. Like, man, when I sit, my pelvis feels like it's falling apart. I stand for a little bit, and it feels better for a little while, but then it feels like it's falling apart. Getting in bed is really uncomfortable. I'm just uncomfortable in a lot of positions. And sometimes what we find is because those sacroiliac joints have gotten loosey-goosey. Then the muscles around the outside of the pelvis, underneath the pelvis, inside the pelvis, all these muscles are doing the jobs of the ligaments. They're creating this tension down there in that pelvic floor, this constant level of spasm. Babies have a real tough time nestling in there. So then the last thing that I'll also check, not related to the pelvis. So the last thing that I'm checking with her body is really too, how does everything move up here? So we do a really simple combination of tests to help us understand oxygen and the breathing capacity for our moms. One is we just look at a pulse oximeter. So we'll look to see, is she circulating oxygen well with a little clip on her finger. 99% is our goal, 100% is awesome. But then we also do something called a chest expansion test, where we just basically take a tape measure and wrap it around, right about here, like underneath her armpits. And then we have her take the biggest breath in as you can and exhale all the way. What I'm looking for in that test is mom should be able to take a big breath in, and that should be about 4 inches of movement. This mom that I was talking about earlier from yesterday, she had great movement up there for her chest expansion. So that told me between that, she had a psoas that was tight, but the pelvic floor tension in there was from her being an athlete, not from a loosey-goosiness. All those things were very resolvable. And so I've got a lot of positive expectation for her as she's coming in that we're going to be able to resolve this. Now, as far as how long that takes, what my expectation is generally 3 to 8 visits is usually the norm, not only in our office, but also in the literature for chiropractors who take care of expecting moms. And so that gives us a window at 36 weeks of good conservative care for a couple weeks. We can always plan the belly birth if we need to. If there's something else going on, like the baby's wrapped in a cord, or we've got something funky with the placenta, or whatever that might be, we always have time to go down that intervention road, but it doesn't necessarily mean that we're going to have to go straight there. She's probably a candidate for care. So if you have someone, again, we get a lot of fetal and opposition in chiropractic offices, way disproportionate to the number of breech babies that are actually out there. It usually represents 3 to 4% of all births have a baby in that position, but like in our office, it's 25% of our patients. So if that means that we're the ones who see it, right? And so if you have somebody in your world, right, if you have a sister, if you have a friend, if you yourself happen to have a baby who's not in an optimal position getting ready for birth, and it's, we're talking like early 3rd trimester, we've got plenty of time to work on the balancing for your bodies. And I'd really recommend that you find a chiropractor who's Webster certified through the International Chiropractic Pediatric Association. You can find that at discoverkidshealth.com. Here locally at Mama's Chiropractic, we've got 3 offices, one in Northport, one in Fort Myers, and one in Cape Coral to help serve our patients, and be really happy to see you. If you have questions, as always, leave them here in the comments. We check this on YouTube. We put them out on Instagram, and we also do Facebook Lives. So I'll look forward to seeing you at the next One Belly Wednesday. One Belly, Two Brains is the blog that we use to help inform people about all these cool things with pregnancy and baby's first year.